me. So this topic tonight, very, very close to my heart and what God can do and will continue to do, right? So, all right. So I'm thrilled that Carole Chin is here, and I'm going to read it directly as part of my healing. Carole Chin has been in the healthcare field since 1982. She became a registered nurse and worked in the intensive care unit, critical care, and burn unit. She became a nurse practitioner in psychiatry in 1993. Carole then worked with dual diagnosis clients who have both drug and alcohol or alcohol addiction and mental illnesses. In 1995, she developed and directed the first HIV/AIDS Day Treatment Center on Long Island. At that time, she also maintained a part-time private practice, and by 1997, Carole transitioned to her full-time private practice. She treats people from age 2 to 92, treating a wide range of behavioral and psychological disorders such as ADHD, anxiety disorders, bipolar and mood disorders, schizophrenia, and so on. In addition to this, Carole was the director of the Higher Ground Ministry Outreach at the Upper Room Church for about 8 years. This program included weekly teaching, preaching, and training of lay counselors who then ministered to individual and group clients with addictions and mental health concerns. Carole presently presents at speaking engagements both for her profession and ministry and participates in both at-home and abroad mission outreaches throughout the year. And how glad and grateful are we that she is here tonight. So please welcome our guest speaker for this evening, Carole Chin.
Hello, everyone. Okay. Thank you. We have a great crowd tonight. This is good. Is this good or is this bad? A lot of you are having anxiety. I don't know. Okay. So it's going to be very interactive and very informal. So let's get started. When you hear, well, first of all, I just want to thank Samantha and Eugene and my, where is she? My co-laborer in ministry and in practice, Kathy Ober. Where's she? Oh, there you are, over there. And all right, so let's talk about anxiety. When you hear, how do I get this off here? I like to be free. Oh, there we go. When you hear the word anxiety, what comes to mind? Fear. Okay, fear. Stress. What? Hell? It can be. Huh? Sweating. Okay. Okay.
I sweat, I can't breathe.
Okay.
I have to stop the car in the middle of the bridge.
Okay. Anyone else? Any other thoughts when you hear panic? You would suggest
Nervousness,
Okay.
phobias.
All right. Bondage. It can be. All right. So you're pretty much all correct in terms of anxiety. But I just want to share a couple of things. Anxiety is treatable, curable. Curable means it can be gone. Treatable may be that we're just managing it, but it can be managed. Okay, so that's really important. The emotion of anxiety. Do you think the emotion of anxiety is a normal thing? It is. All these emotions that we have, God gave it to us. They're all pretty much normal. When then is it a problem? Any thoughts?
It becomes high anxiety when you're unable to function.
When it interferes with your functioning, your lifestyle, thought patterns. Okay, so maybe some of the choices you make, you continue to act on it, becomes a problem. All right.
When it's not tied to something rational.
When it could be not rational, yeah. And so, we say, when do you treat anxiety? When it's becoming a problem to you or someone else. Because sometimes it's not a problem to you, but it is a problem to someone else, right? So it's a problem to you or someone else. We look at maybe intensity, if it's getting too intense, frequency, or duration. How long is this lasting? And again, is it hindering you? Is it uncomfortable? Is it creating a problem to others? 5.7 million people suffer from anxiety. It's a very common problem. And it has various different components to it. It's biological, psychological, and intellectual on some level. And what I mean by that is we can learn anxiety by some of our experiences. So it can be a learned thing and a learned behavior, and I'll get into that a little bit. And it also has a biological chemical component. Have you heard of something called neurotransmitters? Okay, we have a bright group here. Okay, I have to step it up now. Okay, so, I'm going to throw that at you. Can name one of them by any chance? Am I pushing it now? Serotonin is one. You've heard about serotonin. Dopamine. Oh, boy. I'm going to just sit down. Yeah, so there's serotonin, there's dopamine, oxytocin, endorphins, all of these kinds of things. You've heard these words thrown around. And there really has a chemical component as to how these particular chemicals operate in your brain. And it has a lot to do with also why you might have the feelings of anxiety. And genetics play a role. What do you think? Now, that's very debatable. Is it biological? Is it learned behavior? You've seen your mom do this, so you do this. They're worried about that, so you're worried about that. So there's both components when it comes to that. And anxiety, a lot of anxiety-related disorder is relational. When you take a look at what is the root behind it, the therapy, if you will, root behind it, some of the things, the issues that you might deal with, they're really interpersonal and relational. How people treat you, didn't treat you, abandonment, rejection, things like that, interaction, what happened, didn't happen. And a lot of that could lead you with the feelings of anxiety. All right, so it is multifaceted. Now, let me just stop and kind of throw in a little commercial here. This is educational. We're not basically diagnosing anyone. We're not treating anyone. Just very informational, educational. And for some of that, you would really have to seek a professional, and you'll kind of understand that more as we go along. Okay? Because it's also complex, and there's a variety of different types of anxiety. And like I said, most people, you're not neat in a package. You have a combination of this or that. Okay? And then you have a variety of other health conditions that you may have that would determine what's done or not done, or what could be going on, as well as, I said, the psychosocial factors, or, your issues, your family, stress, things going on. So you can't just, probably from this, you have a general idea, but you really cannot just diagnose someone based on that. I give you an example of something else a little different. There was this little boy, and he was always coloring everything in black. Always, no matter what he did, it was in black. So what might someone think? Huh? Dark thoughts, anything else? Depressed, what? Only had one crayon? Close, very close. That's why you got to really know. And you have to observe, and you have to ask questions. Because the reality is this little boy was a little bit slow. The teacher had crayons like on the other side of the room. When it was time to do a project, by the time he got there, black was the only one left. So here you are thinking this kid, he's all of this, and you really have to question and explore and look into it. It's not always black and white, so to speak, okay? So you really have to, evaluate and so forth. So, all right, so we talked about a little bit about, now there are tons of anxiety disorders. I guess when I asked Joel about anxiety, I think I got about 4 possible disorders from some of your descriptions thrown out there, or what I would say some of the symptoms that could fit into that disorder, okay, because it's quite vast. And I want to also add, we use the word anxiety freely, don't we? It's part of our everyday language, isn't it? Yes. Oh, I'm feeling that anxiety. I have anxiety. So, just like when Samantha says, when she's even saying, well, she has anxiety, what do people say? Oh, get over it. I deal with that all the time. Get over it. This is what I do. But there's a difference between a feeling of anxiety, that's a feeling that we have, that we all use the word, I feel anxiety, and having an anxiety disorder. Okay? So that's important, because that's why sometimes maybe people don't give you the support you think they ought to, because they're associating, you say, I've got anxiety, just like their anxiety. Oh, this is what I do for it. So that sometimes becomes a problem. And I kind of heard Samantha talk about maybe how the support you might get from clergy or church or synagogues and things like that, how people look at it. Because it's a normal feeling that we all have. When you may talk about your type of anxiety, people that are limited, and I don't mean it disrespectfully, but sometimes people think what they know is all there is to know, and it's not. So, when you use that terminology, they minimize it. Or like you said, maybe use your faith or pray some more or whatever they say, because they think that use of the word, they define it by their own personal situation. And again, it's a normal feeling. All right? And speak a little bit on mental illness, because I think that's important in this environment. How many people think there's a stigma associated with mental illness? Raise your hand. Okay, that's like the whole room. Maybe 2 people's hand didn't go up. How many think there's a stigma associated with high blood pressure? Raise your hand. Okay, 1 hand. Okay. And the point I'm really trying to make is that a lot of these psychological and emotional problems have to do with the brain. And the brain is an organ, right? Okay. Just like hypertension has to do with maybe certain cardiac issues, your blood vessels. I could even talk about diabetes, again, which has to do with your pancreas, and it's an organ also. But when it comes to mental illness, somehow it's viewed differently, which is part of the problem. Honestly, I find it much easier to treat non-believers and non-spiritual people than believers and spiritual people. They're very hard to treat. Why is that? Any ideas?
Why am I not healed? If you're saying the scriptures over yourself over and over again, why am I not healed? But perhaps you need medication first to get where you need to be, so you can see the scripture and you can hear the scripture. Because when you're in a high anxiety, you can't hear and you can't function.
Okay. Well, I'm going to repeat some things because they're recorded and they can't really hear you. One of the ladies here mentioned, high anxiety, having this anxiety, you might need medication so that you can hear the scripture. But I think also she's alluding to the fact that if you have scripture, I think Samantha said that earlier at the introduction, and you recite it or memorize it, it should work for you, and that kind of thing. We might not say that with some of the other illnesses, or we do. And my point is, when I'm treating someone that doesn't have all of that, it's just very black and white. We're treating them. I don't have the spiritual component where they feel like guilt or condemnation because they're not doing the scripture right, I guess, because they're not healed, that kind of thing, And I remember in my early years, people used to just call me, and before they'd come in, they would come see me privately and sneakingly and, hiding and maybe want to know our philosophy on things and things like that. I remember one day a patient came up to me and said, can you rewrite this for me? I said, well, what happened to your prescription? Well, I went to church and they said, anybody with mental illness or anxiety, come up here and bring your pills. And they brought the pills up, stomp on it. It was all broken up. And the next day she's like, can you rewrite my prescription? No, but that's real, right? No, but how many times would they say, anybody in here with your diabetes or hypertension, please come up here, drop your pills, and let's stomp on it? They've done that too? Okay. Not as common, but dangerous. But again, there's just a different stigma and thought process. And I think it's important for you to understand it and know that. And it's really up to you to get the health care that you need. Because sometimes people just don't know and don't have the revelation yet. So you just kind of have to take care of yourself. Okay. So let's talk about the different kinds of anxiety disorders. Let's first talk about, I'm going to talk about, is there a clock around? Let me see where I am. Good. Right before me. Let's talk about the more common. There's quite a bit. I can at least come up with 20 different types of anxiety disorders right here, right now. So that's important because they're all different. And so when you're talking about your anxiety, sometimes people may not understand because theirs different. So let's talk about one of the common ones, GAD. Who knows what that stands for? Generalized anxiety disorder. What do you think that one's about? Yes, it's the worrier. How many of you know the worrier? The person it's about general things, rational things, normal things, but they kind of take it to the next level. It's kind of on their mind a little bit more. So, it could be that, the typical thing. Use some of the stereotypes. Yeah, husband might work in the city and he's due home at 7:05 and now it's 7:09. And you're now worrying, and you might have even worried before. You heard there was snow, you heard there's the weather, you're getting worried, and, you all know the worries. You might be someone that's worried. Can they drive you crazy? Yes. Yeah. So the worry, and for a lot of us, we think, oh, that's how they are. It's normal, but it's a health condition. Or you feel like they kind of rain on your parade. You ever have any of those? You'll tell them something, and they're going to point out all the possibilities of the negative things that could happen and what you need to watch out for, right? That's the worry, and you're watching out for this. Oh, remember that? Oh, I heard about this. Or what about, and you're like, oh my God, can you just be happy for a minute? They seem very pessimistic. And, it's normal if you're kids and they're going out maybe to check in, but this is someone that wants you to check in a lot and often, that kind of thing. Because I worry, right? You've had people like that. And my point is, they will demand additional things of folks to do. When you show up, let's say you're that husband that came in at 7:09 and you were supposed to be in at 7:05. By the time you walk in, they're a nervous wreck, upset, yelling, screaming. I worry. And not only have you worried, they have you possibly run over in the emergency room, probably dead on a slab, and these are your worriers. And the things go on and on, worrying on their minds. It's tormentive, it can be. Now again, a lot of these conditions we're talking about could be mild, moderate, severe. you know. So it depends. We can all have a touch. A lot of people have a touch of it, maybe not as severe. Certain things have to trigger it. Some people say, oh, I worry mostly about my children. But of course, I'm a mother. I should. But they go overboard. Okay? You know, I know some that are worrying about something might happen to the kids. So at every recess, they're outside kind of watching. And the whole time recess is going on, they're out there. You know, they go a little bit overboard or, like I said, make a demand. And you could have sleep disturbance. Why is that? Yeah, you're up all night worrying about what you should have done, didn't do, what could happen tomorrow. And the people that worry a lot, I'd say, you remember the whole movie, it was a show, Dragnet? And they'd say, ma'am, just the facts, ma'am, just the facts. That's basically what you have to do with the worriers, because you will start here and they will work themselves up and be over here. All right? And you have to come back and just the facts. Let's stay with what we know for sure. And you pull them back. All right? So that is the generalized anxiety disorder. And again, you know, treatable. Most of these disorders, the majority of them are treated pretty much the same way. With the generalized anxiety disorder, you really have to really work with them to stay in the now. Let's stay with what we know. Okay? They're the ones that will be worrying about next week, next year, college, 10 years from now, and, you know, they're really far down the road. And you say, well, you know, we just have enough to worry about for today. Even the scripture says you got enough to worry about today. Stay in today. So that's the generalized anxiety disorder. Now, the people that have generalized anxiety disorder, as well as all these anxiety disorders, can work themselves up into what? Yes, they can work themselves up into a panic. All of these different anxiety disorders, you can work yourself up into a panic. Okay? So let's talk a little bit about panic disorder. Or some people say, I had an anxiety attack, I had a panic attack. Who knows what that is? Some of you mentioned it.
Panic attack is when you you sweat.
You may sweat.
And you hyperventilate.
You can hyperventilate.
And you're afraid of walking into malls.
Well, it depends on which one you have, but yeah. Okay, but that's a specific type. We'll come to that. But panic, problems breathing maybe, heart racing, sweating, I heard. Any others?
Eating 3 whole pizzas.
I don't know what that is. That could be a whole lot, you know. Someone said 3 old pizzas. That's something else. But, you know, you could be mild or moderate, you know. And I'm going to flip that between the others because they're very similar. Like even the worrier might have headaches and stomach aches and things like that. A lot of these disorders come with comorbidity, which means other disorders like stomach problems. The IBS, I have irritable bowel, I have this, I have that. Because you worry, and you worry, you reduce certain chemicals that is destroying the lining of your stomach with all this worrying. Okay? Now, the panic disorder is similar but more intensified. You can have problems with breathing. You can shake or tremor. You ever see that? Palpitation. You know, we said shortness of breath. You can have sweating. You can get flushed. You can feel like you're going to pass. You usually feel like you're going to die. You know, a lot of the panic people, you know, a lot of people are depressed, but they don't always come get help. But the panic people, they're there. And panic disorders cost quite a bit of money to healthcare because you're always getting this very expensive workup at the ER, right? The emergency room, because you do feel like you're going to die, a heart attack. It can be that intense and it's that scary. And you can have some other symptoms too with panic disorder, like pain. There's some people that would always like double over or have pain, and you go search it out, but you can't find it. But you can have pain. Some of you, if you've had that and you've gone to the ER a number of times and then done the EKG and, they do all these tests and they run these scans. And after they've seen you there a few times after a while, they say, I think you need to go see someone. They'll tell you to go get an evaluation. You might need to see a psychiatrist or nurse practitioner or so on, because it has more of a psychological component after they've ruled out everything else that's going on with you. So you can work yourself up into a panic. Again, mild, severe, moderate. It doesn't have to be as intense as getting you to the emergency room, but it's pretty scary. I think I heard someone say they had to pull themselves, they'll have it while driving, you got to pull over, that kind of thing. Your thoughts could, run away with you when that's going on. So we have panic disorder. We've talked a little bit about generalized anxiety disorder. Then there's some of the common ones. I heard someone else mention social anxiety. What do you know about social anxiety? Fear of being around people. Okay. Now, what the category we're in now is really what's called phobia. What's a phobia? Afraid of something. Phobia is fear of something. The one that we talk a lot about is the social anxiety, because it is common, but there are others, but that's the one again, because what can social anxiety do? Isolate you, hinder your ability to function, go to work, maybe school, things of that nature. So you hear a lot about that one, maybe more, but phobias of fear, and there are a million fears. Okay, who knows of a few common phobias or fears that people have? Bugs, fear of bugs, arachnophobia, fear of heights, fear of leaving the house. We call that agoraphobia. Claustrophobic, closed in. Huh? Fear of confrontation. Okay. Anything else? Elevators, bridges, stairs, water, flying. That's a biggie. I mean, a lot are big, but that's when people will come because, I need to go here. My son's graduating. I got to get to his graduation. I don't want to drive for 2 hours. Huh? Germs. Okay. Dying. You could have a phobia about anything. Anything. You could have multiple phobia. You can switch your phobia. Huh? Yeah. That's a good one. I don't know if that's listed. But someone said, pay my bill phobia. So I said, I don't know if that's listed. Fear of blood, fear of needles, right? And we said heights. So the list goes on in terms of the fears that you can have. But let's talk about a little bit more about social anxiety. I want to get into that one because, like I said, the others are debilitating, but that one very much so because it has to do with interaction on a regular basis. Who knows anything about social phobia? What can you tell me? I guess you're here for me to tell you, right? But you could become introverted. It can immobilize you. Anything else?
It might get you sick if you don't take showers.
Well, that's different, but you can.
Or stop the medication.
What can happen is when you have some of these disorders, if they are progressive. So a lot of the disorders you can have, all the disorders really, if you don't really take care of it, after time it becomes progressive. Okay. Oh, I talk the fear of driving. Many people will come in with that. I used to be able to drive on the highway. Now I can't drive on the highway. I'm on, the service road. Now I can't drive on the service road. Now I can only do up to here. And then after a while, I can't leave my block. And then I can't leave my driveway. Some of you have heard and known about that, and so it kind of comes in on you. And the same thing even with social phobia. I used to be able to socialize. I used to be able to talk to people. Now I can't do this and now I can't do that. And there's quite a range, but it is a certain amount of anxiety that you feel when you have to do any kind of interaction, right? It could be as simple as making a phone call. What do you think? Some people, that's hard. Please make an appointment. They can't make the appointment for themselves. Okay? Something as simple as that. When you may be out and you see people, you kind of run and hide. Supermarkets are big for that. You run and hide because you don't want to run into people. You don't want to have this social interaction. You don't want to talk, right? Some have it. You'll go shopping late at night or when everybody's eating, when there's not that many people at the store or whatever, because you're afraid of maybe crowds. And it varies. But in social anxiety, the biggest thing, whether you realize it or not, is the fear of saying or doing something stupid. It's the feeling like when you walk into a room, all eyes are on you. They may not be. They may not even care. But that's how you feel. Okay? And again, everyone is different. Some cannot pull up to a 7-Eleven, mom and tell her, go in there and get milk. They can't go in. They can't go get milk. Some could have social anxiety, but can only go in and get milk if you come with me. You ever heard that? Come with me. Would you come with me? All right? So you have some people that as long as they're with someone they know, they can go. Same thing. Gee, there's a party, a social event. There are some that can go as long as they know someone was in there that they know. Others maybe, I can only go if you walk in with me. I could only stay if you stay near me. The minute you move away, I'm out of here. Okay? So there's such a range of social anxiety. There are those that, no, the mall is fine. I could be in a crowd in the mall, I'm good. But I can't be around a lot of people that I know. And there's some that I can't be around anybody, any crowds, any group. There are those that I could be with the group. I could be with the groups that I know. Then I'll say, well, what happens if someone new joins the group? Oh, then I climb up and I shut up. I have nothing to say. So it really has such a range, social anxiety. But it is that, and it can get to the panic feeling, which back to panic a little bit is that fight or flight reflex. I got to get out of here. I'm going to drop my groceries in the supermarket and I'm out of here. I'm not, I can't finish, whatever. You're out. When that starts coming on you, that feeling. You got to get out of there. Now, some people can have social anxiety and don't have all that. And a lot of them, when I talk to, you sometimes you have to spend some time really trying to evaluate because they may not even appear to do a lot of that. Oh, no, I don't have a problem with that. Oh, no, I don't have a problem with that. A lot of times they don't have a problem because they start avoiding, right? If some things make you anxious, what do? You avoid. You withdraw. So do you have a problem with driving? No, I don't have a problem with driving. You don't drive anymore. Of course you don't have a problem with driving. Right? And slowly your world begins to close in. And some people, like I said, they'll be like, oh, I remember someone I was treating came, I'm not even sure. Half of the time people come in for different reasons, then we discover all the other things that are going on. Because I'm sure she didn't come in for anxiety of this nature. But then we discovered, like, you're always getting dropped off and picked up. What's going on? Don't you drive? And then as you began to evaluate, no longer drives. But no need to drive. Why? We're amazing at compensating. We're survivors. This particular person got it so good that If something's going on with the kids, you know who got them? The neighbor of the family. You know who did all the grocery shopping? The husband. If I would say, well, you're doing better now from based on some things we've done, I think you should be able to do this. Oh, I don't need to do that. And my point is, you will not have a need because you've designed your life where you have become pulled back from things. Very social at home. Could always have a party. Everybody come over. The house could be the party house, but they're not going out. They're not going to other people's parties, and they're not out. So sometimes you don't know. They can compensate real well. And I said, well, you know, I want you to start doing this and that. Oh, I don't have a need. I said, no, you'll never have a need. That's why I need you to do this and that. Because you're not gonna, because you've got everybody around you, right? Working to make your life seem to appear smooth. And it appears smooth to you. You don't even realize you have a problem. Okay? So the social anxiety, and I'll give you another case. I had a young lady many years ago come in. Her mom brought her in. Mom's just had it with her. She graduated from high school, but she couldn't get her to work or get a job. So finally she had to get her to have a job at her job working right next to her. So it's just like, this is no good. She comes and she's got terrible self-esteem, and, you know, she, you know, all of these things that she said, you know, about her, you know, she's no social skills, terrible self-esteem, all of these things that she said about her daughter. And it would appear, right? She has no confidence. So I began to evaluate her and treat her, and I discovered she had social anxiety. And as she began to get better, she was able to do things I wouldn't do. She was able to go into, she couldn't go in like a 7-Eleven, or she couldn't go into a store and order bagels or do any of that stuff. By the time she was done, not only could she go into a store, she could sit there, start talking to everybody in the store. And after a while, I no longer saw her as a patient anymore, and she became a model. Did she have a self-esteem? After I explored it, she didn't. Did she have a confidence problem? Not really. She had social anxiety, and it was debilitating, and she was fearful, and she was only comfortable with someone she knew. And if mom said, you know, fill out the application, no, go to a job interview, do this, do that. And you're amazing how many people I've met in different age groups, a lot of your age groups, that said, you know what, I never did take this job or this career because I was too nervous around people, or wouldn't take the train into the city, or your career choices or the choices you make could be so different because of the interaction that you couldn't do. So social anxiety could be like that. Like I said, it's different for everyone. Some people say, oh, no, I have no problem doing that. I could do that, but this thing they can't do. We see a lot of it among children because all of a sudden they'll say they don't want to go to school. They start getting sick Sunday night because Monday is school. So you'll say, is there bullying? Is there this? Is there that? You check on a lot of things, and a lot of times what's starting to happen is they're developing all this anxiety from interaction with other people. So, you know, that's the social anxiety. So we talked a little bit about social anxiety, right? Generalized anxiety disorder. We talked a little bit about phobias. Okay, and again, they're of all types. We spoke a little bit about panic. I'm going to touch just really quickly on post-traumatic stress disorder. Who knows what that means? PTSD. What does it mean? I mean, well, we went what it mean. What is it? Any ideas? What's it about? After a traumatic event, not being able to comprehend or cope or deal. Okay? And you might be triggered. Now, any of these psychological conditions, anxiety disorders, you can be triggered. Like I said, even generalizing anxiety, it might be I only worry about this or that, so it might get you going. Okay? But post-traumatic stress is, again, post, a period of time after the trauma has happened. Yes? Okay. So now you're in it's months later, years later from the trauma. You might not even be thinking about the trauma, and you start having some problems. Okay? Now you can have it can present in 4 ways. You can have nightmares. Many people say, I have these nightmares about something that happened to you that was traumatic, right? You can have a flash, like a vision. You just almost see like a picture flash before you of the event. This could be a car accident. If a lot of people had a car accident, this can happen to you. You can have a feeling. All of a sudden, you just feel like that time in your life. You have no idea it's connected to that time, but you just have this overwhelming feeling. Okay? And then you could have something that has occurred that triggers you or reminds you. So actually seeing something, hearing something, that kind of thing, that actually reminds you. So you can have a dream, like a flash, be reminded, or a feeling. And you'll have it, let's say today, or about something that's going on now, but you will start feeling or responding to it, but it's not what's really happening now. It's something that connects you or triggers you. We heard a lot about PTSD back after Vietnam. Most of you, probably old enough to remember and know about Vietnam. And, you go to war, and a few days later they have you back stateside, and you're still, not only did you not have time to adjust, but you experience a lot of trauma. So now anything that reminded you, like a sound, a car backfiring, what would happen? Jump to the floor, get in, defense mode and whatever, and you will react to the other event in your present circumstance. Okay? So that's post-traumatic stress disorder. Now let me back up a little bit. When we mention phobia and fear, okay, some of your fear and your phobias might be related to prior traumas or things. You may not know. All you know, you have a fear of this or a fear of that, right? You decide, I don't know, I have this phobia. I'm afraid of this, afraid. You don't even know why. But if it's related to something that you experience or a trauma, yes, it's phobia, but the root is really a more post-traumatic stress disorder. Okay? And so it's more of that than really a phobia. Though you fear it, but the root is really something else. Now let me swing over to talk a little bit about OCD real quick, and then we'll talk a little bit about treatment, intervention, some things that could be done and all that kind of thing. OCD, who knows what that is? Obsessive compulsive disorder. What is that? Any thoughts on that? Anybody? All right, you may have to do things a certain way. That's probably speaking to the compulsion a little bit, or a ritual. We'll talk about that. Anything else? Mm-hmm. Since you get on a track where you obsess on a thought or event, in other words, get stuck, okay, on a particular thought, we refer to that as the obsession. All right? So you can have an obsession where your thoughts, you're stuck on something. You could be obsessing right now. Some of you might be missing this presentation because you're off in a thought. And it's important because sometimes I think they have ADD. They're always like daydreaming. But it could be an obsessive you might be off into obsession, right? And compulsion. Okay. The person said here, the compulsion is you feel like you have to, quote, unquote, go there, do something. The compulsion is more behavioral. The actual things that you do. What you may need to do. So it's still obsessive in a way, but it's obsessive type behavior. All right? And then there's also something called rituals that you can have. You have to do things a certain way. Okay? Anybody knows of any obsessions? What kind of thing can you obsess on? Huh? That's the behavior. Anything, I heard. Hand washing is the compulsion, a behavior. But you could obsess on anything. Someone that couldn't go anywhere because they're always worried that they may have a bowel problem. So they're obsessed always about having a bowel problem. And they had to know where every bathroom was on their way to anywhere. And so a lot of times they didn't go anywhere. Because they're so worried about having a bowel issue. So that's their obsession. And you can't kind of get out of your way. Okay? You will have an obsession, and you don't have to have all three or both. You could just obsess. Some people, that's all they are. Some people have compulsions, the behavior. You may not be connected. But a lot of times you will do that compulsive behavior as a way of working through the obsession that's on your mind. You'll do that kind of behavior to kind of, and you kind of, that's why you do it a couple of times till it's kind of, you feel, okay, I'm good. Right? And then rituals, you have to do it a specific way. And then when someone interrupts you on any of this pathway, what happens? You can get upset because you're really having a lot of anxiety, and this is your way to kind of work it through, and then people are talking to you when you're trying to obsess. How annoying. You know, you get all this going on. And they're like, they're interfering. You need to do this because this is freeing you. Or your behavioral compulsion that you need to do. Okay? Or your ritual. If you have a ritual, God help you. Because you have to do this, that, and that. And I heard someone saying, if it's interrupted, what do you have to do? Start all over again. I remember there was this one lady I could hardly help. Somebody would come in, different people in at my office. There's this lady there. She keeps opening the door, putting the keys in, closing it. Open the door, putting the keys in, closing it. It went on forever, and you could literally watch her for a long time. It was a big problem. These things are big problems. People's job, they get on disability, they have marital problems, family problems. A lot of these anxiety disorders get in the way. She could never get to work. Forget about work. She couldn't get her kids off to school. And it's very debilitating. Like I said, a lot of these anxiety disorders can become progressive. I had one young girl obsessed on noses. So she would date a guy, see his nose. No, that's before piercing. I'm telling you about old cases because I have to protect the confidentiality of people. So I'll change names, some details so you could never, male, female, age, that kind of thing. Or give you some stories that you could never figure out who it is to protect people's confidentiality. But she would obsess on the guy she's dating, his nose. Until you ever watched the Odor Eater commercial? They said, I think you've gone nose blind. You see the commercial. You'll see this, guy sitting in there and, the room smells like a huge locker room of socks and sweaty guys, right? And he just kind of smells this. Well, it would be the opposite. It would be this nose. And by the time she's finished with this nose is like, the size of the room and whatever, and she'd have to always break up with every guy because the nose, you know. So you can obsess on anything that creates a problem. And I always said the problem to you or someone else, because people say, that's not a problem to me, but it's a problem to other people. A lot of our obsession and our rituals, we get other people involved. Right? You get other people involved. I believe it was Dr. Phil once. There was this clip of this man that was there, said, can you please help me and my kids? You know, he's getting a divorce. I think he wanted to get his kids away from the wife because she was a clean freak. She loved to clean. They had 2 kids. I think they were like 3 and 4. What do you think the kids were doing? Cleaning. Time for their birthday, Christmas. What do you think they wanted? Yes, a vacuum cleaner, broom. Father's like, this is out of control. The kids are little mini cleaners. Okay, so remember I said, is it learned or is it chemistry? You know, some things you can learn or chemistry component. So as you could see, these things can become very problematic. All of them can become very problematic. If you're involved with someone that doesn't want to go anywhere because they're always anxious socially, so you have to go everywhere by yourself, or they won't go, or they don't want you to go, you could see how that could become a problem. It becomes a problem with children going to school, adults going to work, things of that nature. It can really be. And again, all of these things can be worked up into where you develop a panic. Now, most people, when we give these diagnoses, they're based on, you know, maybe you have to have, there are 10 possible symptoms, and they could be broken down in different categories, and you might have to have 6 out of 10 to get that diagnosis. So, you know, a lot of times we're not all in boxes, not neatly. You might have, you know, 3 of that one and 4 over here and, you know, 2 of that, and you have a variety of things. Most people I see with a variety of things going on. But like I said, depending on what the root is, a lot of it is treatable. For example, with post-traumatic stress disorder, it's not so much focusing on what's going on now. The root is really to start addressing the trauma that you've experienced back when. That's really the treatment modality, the root behind it. Like I said, a lot of these anxiety disorders are the interaction you've had. Some are root from childhood, and you could have problems anywhere along the path. Same thing, phobias. What's your fear? Sometimes you need to talk about, oh, you don't even want to talk about it. It's scary, just the very thought about it, I begin to sweat. So many times you have to get to like, well, then what will happen? And then people never go past what might happen. Or even the same thing with the generalized anxiety disorder. I said you bring them back to just the facts, but then sometimes you say, well, then what? And sometimes when we follow even our thought process through, it's not as bad as what we think, but we never go beyond that. Okay? And so some of it in therapy, dealing with these issues, situation, circumstances, we can bring about a lot of healing. But a lot of it has to do with an imbalancement in any of these neurotransmitters. Remember I spoke about them earlier? You know, like one of the ones that's most common we talk about is serotonin, maybe dopamine. Any imbalancement in these areas. Now, there's different schools of thought. It could be that when you're undergoing some of, and we didn't bring out the fact of stress. We talk about post-traumatic, but there's acute anxiety. You're going through something now, maybe something at the job, some kind of work pressure. Anybody that's in an accountant, that kind of thing, when it comes around tax season, they're like, you know, they're stressed out. They could have a lot of anxiety symptoms. Go into that acute stomach, can't sleep, you know, a lot of what we talked about, but it's more with them specific to their duties or responsibilities. Okay, that we can refer to as acute anxiety. You can have acute anxiety. Then, and like I said, there's a whole lot more that I can get into, but I won't. But I want you to understand that, is it that when you're under stress, you are depleting these neurotransmitters that you have? For example, we produce serotonin in our bodies, and we store it. And so sometimes you say, well, how does some of these meds work? We don't always 100% know. We know what they involve, and we know they have to do with like a gatekeeper of allowing a certain amount of your own neurotransmitters to be available to you. So in other words, some of the medicines will say, hey, don't store as much serotonin that they're producing. Leave more in their bloodstream. Leave more available to them, because they need it. It's like your rainy day you store. They need it now. So is it that the stress or whatever you go through or your imbalancement, you're depleted, or do you need more? Not depleted, maybe okay level, but you need more. Okay? So that's how some, there's some natural products. You've heard about maybe St. John's wort. That's really a medication. That's really an herb, so to speak, that has to do with serotonin. But it's more natural, so, you have that. You've heard of valerian root. Some people have tea. It's relaxing. Kava. There's a couple of, things like out there. Again, not everyone should try everything, because there are other anxiety disorders I did not cover that has a different biological and medical component that if you utilize some of that, you might end up in the hospital. There are anxiety disorders that's associated with a mood disorder, like a bipolar, where people in that condition have a lot of anxiety symptoms. Oh, I'm anxious. I have a lot of anxiety. I feel anxious. And they do. So that's why sometimes you don't know. You can have someone with both depression and both anxiety. You can have someone that is also bipolar with an anxiety associated with bipolar, as well as have OCD, and as well as have the other anxieties. So you got to know what you do, because certain medications will put someone into a mania where they're like manic, or severely depressed, and as well as sometimes we think just because something is natural in an herb, we can just go take it. So I'm giving you informational, but I'm in no way saying run out and go take some of these things, because it, depending on what you really have and what's going on, or those might be problematic. Again, it depends. We called it, most of the people that come to see me, basically what happens is a lot of you have anxiety. You try to manage it the best way you can. Like some of you said, maybe scriptures, prayer, not negating some of that, all of that. That has its place. And then you might usually you'll go to see your primary care provider. And they will either, for the panics, we use a lot of the benzos. Back in the day it used to be the Valium. Now it's the Xanax, the Ativans, the Klonopins, things like that. But they're for short-term use. Though I've seen people come to me, have been on it for 20 years, 30 years, 10 years, a long time. And you'd say, well, we're not really getting to the root. We need to do this. They say, why? It works for me. Why should we do that? Those are, highly addictive, very dangerous, very easy to overdose and kill yourself on them. So, then the other meds we're talking about, you've heard of, is the ones that affect serotonin, and there's a whole slew of them. There's atypicals, there's those that just have serotonin inhibitors, some are what we would say antagonists. They work differently. But again, these control the gate mechanisms, and they could be useful short-term, periodically. There are some things that you could do. For example, I mentioned endorphins, which block pain, physical pain, emotional pain, and you can release endorphins. It's more for short term, but by exercising, stretching, laughing, comedy shows, coming here to some of the entertainment I know that you guys have here, laughing. That is really good. Yeah? that reduces some endorphins. Okay? So that's another thing you can do. Serotonin is released by gratitude. Gratitude. Write down every day 3 things. Start your day off that you're grateful for, and you release serotonin. So have a grateful heart. You release serotonin that way. Serotonin gives you the sense of I feel good. It's more relational that we have from a lifestyle of maybe where you feel respected. It gives you that feeling. Oxytocin, you might have heard on, this is one that gives you a sense of security or trust. And that comes from, another terminology is bonding. People in your life. Touching. Hugging. That releases that. And oxytocin blocks pain. So that helps you. And so that's another thing. Of course, if you have issues, you may not want people touching you. If you're social phobic or you've been violated. I mean, you have to use everything in context. You know, hugging people that don't want to be hugged, getting close that don't. That's not going to relax them or help them. You know, you're just going to make them more anxious. Okay. And dopamine, again, listening to music releases dopamine. Why? Dopamine has to do with reward. When we listen to certain music, especially music that we already know, we know what's coming next, the next word, the next song, yeah? So the next note, the next melody. So when you do that, it releases dopamine. You watch the Golden Girls? You know, at the end, they'll always go get cake or something because that's their reward center. The feeling of getting cake and stuff is a positive feeling. And so they release dopamine. Now, that's unhealthy dopamine. That's like when, I mean, the dopamine is good as the unhealthy process. Just like when we're depressed, we want to go eat or something. We want comfort food. Why? Because it gives you that sense of you can count on it, you know, that kind of thing. But believe it or not, listening to music that you already know the words and you can count on it helps you release dopamine. And so I'm just giving you a couple of things that you could do. And let me add that, and I'm going to kind of close. One of the biggest enemies is cortisol, because when you're having anxiety, you isolate, you know, the absence of social interaction, contact, and not laughing, not moving because you're depressed and your body hurts, or you're having a panic attack, that kind of thing. We release a lot of cortisol. And when that is released, that a big rush of that gives us panic and fear. That's where the fear comes from. And the dribble, you know, the little by little is what gives us that like anxiety, you know, the stress over time. Okay? So there is a physiological, if your dopamine is maybe, you know, levels are low, or your serotonin levels are off, or your endorphins and these kinds of things that we're talking about, you can see why you would have anxiety. There's a root behind anxiety. So these are some of the things, along with, you know, getting to the root, some therapy, medication, you know, management, exercise, things like that, that could make a big difference in how to handle anxiety. Coming together releases that feeling of trust, security, coming together in a common topic, theme, you know, talking to people that, wow, you know, they understand me, they can relate to me, that sense, that feeling, that releases oxytocin. Like even today, coming together right here, you release oxytocin. Some laughter that we've had. Okay? So I'm going to stop here. I hope I've met the objective of going over different kinds of anxiety, giving you the biological. And I said genetic because we do see some things in families. Again, is it learned? Is it chemistry? But we'll see it running in families. Who in your family had, when I meet people, who in your family has this, that, and the other? You talk about the mother's side, the father's side, and you usually see these things kind of running. Now, one of the things that we said is the ineffective, I didn't cover that, way of coping, which is, again, do nothing, the isolation, they're becoming recluse, to allow these disorders to progress, to turn to drugs, self-medication, alcohol. A lot of people drink the alcohol back in the day. When I do a history, back then people maybe didn't go to therapy, didn't know about certain things, so you find out, what's going on, who are the drinkers, the drug. Because when you drink, you're more comfortable, right, socially? If you have social anxiety and you have alcohol, you're not as nervous anymore. You can talk to people when you take something. See, and that's what sometimes leads someone to develop more of a problem than someone else. You take a drink, you can leave and go. When they take it, it does something. My God, I'm not nervous. I'm not anxious. I can talk to people. I can come out of my shell. So you can see where there's that potential to repeat it. Last thing I'm going to say is these are all neuropathways and neurological pathways that develop from what we experience. Like I said, all of these situations that go on in your life etch a pathway in your brain, so to speak. And the repetition and the memory is there. Okay? But you can retrain, and your brain has the ability to form new neurological pathways. So, example, if I always got to understand why I react this way, and I realize it's not this, and I begin to train myself not to do that, I do something healthier, I am now etching a new neural pathway in my brain. Okay? One of the other chemicals I didn't talk about is adrenaline. That comes up to help us, flee. To, from, we don't know which way to go. But adrenaline is almost released as we continue to repeat ourselves. It kind of speeds it up. But in these processes, as we learn, so it's never too late to get to the root, get help, and retrain, re-understand, and look at it. So you can excrete different same transmitters and use them in a positive way and reshape your neurons. So that's why I say a lot of these disorders are curable and are treatable, which means to manage. All right. Thank you so much.